Eyewitness News reporter Nicole Todd caught up with Congresswoman Claudia Tenney to talk about them. Nicole?
After just returning from the Middle East trip, Congresswoman Tenney said it's given her insight on the refugee crisis abroad and here in Utica, alongside many issues involving health care for the middle class. Congresswoman Claudia Tenney says that taking a trip for a week to the Middle East was beneficial to learn how the refugees are handling their crisis. And to come back home to Utica was a complex learning experience because of our large refugee population.
Where we have a large refugee population and just the impact of bringing more refugees in, how it impacts us, what we can rely on coming from these countries, who's coming in from across the Middle East. It was just really interesting from that perspective. Also meeting with people in the military and dealing with how they're handling the war and the destabilization of the Middle East and the harm to the economies there. Back
home in the U.S., Donald Trump and fellow Republicans are heading back to the drawing board for a new health care plan. Tenney says while the proposal wasn't perfect, she's disappointed that as a New York delegation, the state would have had relief on local share from governments lowering taxes.
We also were going to be able to eliminate the individual mandate, eliminate the employer mandate, which would have been a huge bonus to the small business community and the middle class people who have an insurance plan but have such high deductibles that they have no access to a doctor. So we were going to try to find affordable health care to people who really need it in the middle class, and while protecting our Medicaid expansion. It wasn't perfect, but the bill would have been a huge increase in per capita aid and a huge improvement over what we have now with the Affordable Health Care Act.
Tenney also says that in the president's budget, he's trying to cut the deficits and reduce the national debt, adding there's some parts she doesn't agree with that directly impact businesses negatively in the Mohawk Valley.
I'm worried about block grant funding being cut off to our cities in our area. We really need the assistance, and the block grant funding extends down to, a lot of programs that we need for the truly needy. I was happy with a little bit additional money and additional support for us to deal with the heroin and opioid addiction. That was okay.
Tenney says she hopes they can negotiate to get good things back in our region. For more on what the Congresswoman is doing, her number for questions is on the bottom of your screen while she's in town.